to attend. And we will also be covering the campaigns by President Uhuru Kenyatta in Busia County. He will be holding rallies in Port Victoria, Funyula, Bumala, Matayos, and Amagoro as well. Right, let's take you now to Nakuru County. Our Patrick Amimo is standing by there for us. President Uhuru Kenyatta is this morning expected to preside over the groundbreaking ceremony of the 45 billion shillings Kabarak University Teaching Research Referral Mission Hospital. Former President Daniel Arap Moi is also due to attend the launch of the 500-bed state-of-the-art facility, which is expected to be operational by 2020. The project will also oversee the modernization of 23 mission hospitals across the country under the Christian Health Association of Kenya. The project will be financed by US-based private equity CJEC International, among other stakeholders. Patrick Amimo is joining us live from Nakuru County, where this ceremony is set to take place. Patrick, good morning to you. Talk to us about the program this morning.
Thank you, Sophia. We are coming to you from Nakuru County and Kabarak University, as it were, where we're gonna experience at least a modern private hospital that will be a game changer in the region. And this particular idea was mooted back way back in 2012 when Kabarak University signed a memorandum of understanding with the then Minister of Medical Services that was led by then Minister Professor Anyang' Nyong'o. And that's when the university was given that opportunity to start training students in medicine and other medical sciences. And joining me is the Dean of the School of Medicine and Health Sciences at the University, Kabarak University, Dr. Wesley To, just to explain to us, maybe since 2012, what really happened after the signing of the MOU.
So thank you very much, Dr. Mimo. As you've heard, my name is Dr. Wesley To, the Dean School of Medicine and Health Science at Kabarak University. So just to give a brief overview, is after the signing of the MOU with the Ministry of Medical Services, then, in the background, there has been revising and working on the curriculums and the programs that were preparing to come. So the first immediate thing was the recruitment of the staff and the establishment of the school. And I'm pleased to tell you, Patrick Amimo, that at Kabarak University first established the School of Medicine and Health Science in 2013. And then before that, there were a lot of signing MOU with partner institutions where we would take the students to practice and to have the clinical experience, because the nature of our training is that we have the students having to go to class and get the theory, and then we have the students to go to clinical area. Yeah, so that is basically what happened after that. So there were a number of institutions that were brought on board, a number of hospitals were brought on board, including Tenwek, AIC, including AIC Kijabe, including Litain, that have come on board. Yes, and even Chogoria, because we are training the family physician, that is the Masters in Medicine. Yeah, another specialty called family medicine. Thank you. Yeah.
Looking at it, maybe even Kenyans out there, or those are potential students or doctors who might want to aspire to come to Kabarak as now you launch this particular facility. They would be interested to know, maybe in terms of what are these the programs, health programs that you do here in Kabarak University?
Yes, thank you very much. I also want to say, before even I mention the programs that we offer at Kabarak University, that Kabarak and the programs that we have here have attracted both national students and international students, and that is a real thing that we are looking at and saying. Especially in the family medicine program, we have students from Southern Sudan, Congo, that's DRC, we have from Rwanda, Burundi, and that's something that we are thinking it is great for Kabarak, especially the family medicine program. Now, coming to the programs that we offer in the School of Medicine and Health Science, we have a number of them. Let me begin with the BSc in nursing, that's degree in nursing, and then we have the BSc, that's a 4-year program, and then we have a BSc in clinical medicine and community health, and then we have another that's training now the clinical officers, that is much needed out there to supplement the shortage and the crisis, the shortage of the healthcare workers in the country. We also have other program that includes the Masters in Medicine itself. That's another program. And then we have the BSc in Environmental Health. The BSc in Environmental Health trains the public health officers, as you know, in the country. We also have the BSc in Nutrition, Human Nutrition and Dietetics. And the programs we have just mentioned, we are offering some in diploma, some are in master's, some are in BSc level. Thank you, Amimo.
Looking
Yes,
at it, what has been your clinical experience? Because as an institution,
Yeah.
you did not, you had to rely with other support institutions to offer maybe the practical experiences and the skills for your student and also research.
Yes.
How has been your clinical experience so far to date?
Yes. Thank you very much, Amimo. We have partner institutions that we are doing work together as Kabarak University. The number one partner is the provision, County Referral Hospital here at Nakuru. And that is one partner institution that is the government and the Ministry of Medical Services or Ministry of Health. By then, Ministry of Medical Services, now Ministry of Health. We have signed an agreement and we are taking our students there. Then we have other additional partner institutions that include Kijabe, that include, these are the mission hospitals, that include the Litain and Tenwek. And we also have brought Chogoria on board, especially for the master's program in medicine. And we are expanding these kind of partners and the hospitals to include now Naivasha. The Naivasha Sub-County Hospital is now in there. And also we have the Kericho County coming. And we also have additional hospitals that are coming. Like we are working with other missionary partner institutions, and we are going to expand the number of partner institutions so that we're able to address and meet the clinical needs and the areas and the experience of our students. And just to add on to that, Amimo, I just want to say, you know, our programs you can't do without hospitals. You need the hospital set up so that the students are able to get the best and requisite knowledge and skills that is required. As soon as they graduate, they're able to, you know, function competently and with the highest standards possible. Yeah.
Looking at it,
yeah.
today is a day when now you're going to do the groundbreaking ceremony
Yes.
for the 45 billion
Yes.
teaching, research and referral hospital that will be based at Kabarak High School.
Yes.
How will this be a game changer in terms of impacting skills to your students as they go out there?
It's not Kabarak High School, it's Kabarak University, Patrick Amimo. So where we are is Kabarak University School of Medicine and Health Science, and I'm happy to say, and at this time, just want to thank His Excellency, the second president, who is the Chancellor, you know, second president Daniel Toroitich Arap Moi, who has contributed, you know, tremendously in the growth of this university, and in particular support that we have for the School of Medicine and Health Science. So he has done a lot in contributing to the education, especially in the area of health science, because the recently completed building that we just opened last year was dedicated for this school. It's ultra modern, just behind us here, and I want to just say and begin there that you know, we want to really thank him. And coming to the event of today, you know, we are going to be having the groundbreaking ceremony for the hospital. And this is going to be the Kabarak University Teaching Research and Referral Mission Hospital. So I want to say we are partnering with a number of international organizations to develop a 500-bed capacity, you know, multidisciplinary tertiary hospital to be located here in Kabarak University. And in addition to that, we're going to have additional branch again in Nairobi. That's a 250-bed hospital for Kabarak University. And this kind of development now, Patrick Amimo, is going to be a game changer, as we say. It's going to bring us a new perspective because, you know, we are actually going to train now the healthcare workers who are no longer in need to leave the country, but actually we're able to meet the standards, you know, we're able to meet the high standards and embrace the ethics of continuous quality improvement. And we hope that with this advent now of the hospital coming here, we're going to have a lot of activities, especially in the training, it will go high, and the standards will change. And as you know, the hospital that we have here, the mission is to be the center of excellence for compassionate clinical referral services for health professionals, education, and research for the God's own glory. So in short, we're going to have specialty trainings. And also, we are not going to leave our partner institutions. The partner institution will still be there, but we're going to have additional training that will be happening here at the referral hospital. Yes, thank you, Amir.
Yes, just looking at it,
Yeah.
you indicate that it will be also it will be a center of disease prevention and control in Africa, and we're looking at it strategically placed. Given that Kabarak University is in Nakuru County, which is almost to say maybe it's like it's a regional. It could be like the center of a regional hub, looking at East Africa country region: Tanzania, Uganda, Rwanda, Burundi, South Sudan, where you have students from this particular region, and also dealing with 23 mission hospitals across the country. Now, how will these impact the region, East Africa region, and also Kenya as such, given that we now have we'll have equipped ultra modern facilities?
Yes. The implication, the impact is going to be there, because this is, the centrality and the location of this, the central part of Kenya. So this hub, the Kabarak University Teaching, Research and Referral Hospital, will provide advanced type of care. And that will be capable of diagnosing and treating the most complicated cases, and it will include the specialties in cardiology, specialties in cardiothoracic surgery, the cancer center, the women's and child health, and also the neurology and minimal, the invasive procedures. And we're going to have the state-of-art equipment. We have partnered with the leading institutions, and we're going to have the state-of-art facilities, the MRI, the CT scan, the nuclear medicine, the PET,